All right, so welcome to another Hippocratic Adventures interview. I am Dr. Ashwini Bapat, and today we are very excited to have Dr. Carmen Brown with us. She is an obstetrician and gynecologist based in Melbourne, Australia, as well as author of book and website ExpatMD, Your Guide to Living and Working as a Physician in Australia and New Zealand. Dr. Brown, thank you so much for joining us.
Thank you so very much for having me. I really appreciate this opportunity.
We asked our members to submit questions, and we have quite a few. So let's get started. So Dr. Carmen Brown, tell us your story. How is it that you ended up in Australia?
So mine is a kind of straightforward, I guess, story. My husband and I, we're traveling. My husband's an anesthesiologist, and like you said, I'm OBGYN. And we got into our point in our careers that we were very burnt out.
Hmm.
I was over the encroaching EMR. I was getting to the office hours early in the morning just to do notes from the night before, staying 2 hours late, dealing with coding, billing, and all those other issues. And I just could not see myself lasting in medicine for another 20 years at that rate. So my husband and I were doing some traveling, and we came to New Zealand and Australia just as a trip in 2009, and literally fell in love with the country, the peacefulness, the people, just the lifestyle that we seem to see the Kiwis having. And so we started poking around and looking into it, and found a locum position that was 1 year. And we ended up coming back in 2010. So a couple months after we got back, we came to New Zealand for a locum. And I guess, like they say, the rest is history. Fell utterly and totally in love with the practice of medicine in New Zealand specifically, and stayed there for almost 4 years.
Wow.
The reason why we left New Zealand, because a lot of people ask me that, and that's one of the number one questions I get, if they're like, well, if you loved it so much, why did you leave? And mine was really simple. I left for family reasons. I have a 8-year-old boy, soon to be 9. He was diagnosed with autism when he was almost 3 years old. And we lived in a very small rural town in New Zealand. And as you know, as a physician, the key is that you would like to get some early intervention services going so that you can try to give them the best start as possible. And so we made a decision, but we were dedicated to staying overseas and kind of divested at that point from the United States. And so moving across the ditch to Australia was definitely the best option. So now I'm in Melbourne, Australia, and I've been here for 5 years now.
Wow. So you've basically been outside the US practicing for the last 10 years.
Yes, almost 10 years. That's correct. We had a
Amazing.
very short period where we came back after our locum
Yeah.
to sell our house and
Yeah.
pack away things and kind of put together a container to come back permanently. But yes, so almost 10 years overall, we've
Wow.
been overseas.
Congratulations.
Thank you.
Um, in making the transition to Australia, did you have to take additional exams to practice as an OB/GYN?
No, so that's a common misconception. And I believe a lot of people that I've come across believe that in
Mm.
order to practice in Australia or New Zealand, that you have to take additional examinations. And that is not the case for the vast majority of us. And I say that vast majority because I've personally not come across an American doctor that has had to do additional
Mm.
examinations. And that's because Australia and New Zealand particularly take doctors from certain countries
Mm.
based on their training. And we're very lucky in that the United States and Canada, UK, Ireland, and of course the reciprocal agreement between New Zealand and Australia, so vice versa. So in those particular cases, you usually do not require to take any additional examinations or tests. And if you are board certified, even if you are DO, and a lot of questions about that. But if you are board certified in the United States or Canada, usually that will allow you to reciprocally grant board certification in Australia or New Zealand after a period of supervision.
Got it. And what does that period of supervision entail, actually?
So it is actually really I find it was really helpful.
Mm.
I think as physicians, especially when we're established and we're attendings and have been out on our own for a while, when we hear supervision, we immediately think, no, I don't want to do that. But the thing is you have to think of it like it's more of a collegial relationship
Mhm.
with like an Australian or New Zealand doctor that's just going to basically kind of help you learn the ropes of their
Mm.
system. Because remember, a lot of Americans have no idea about the inner workings of the systems. I had to spend several hours with a surgery tech in theater learning the names of their instruments.
Oh,
So
wow.
little nuances and things that you don't think about are really critical in getting you established, comfortable, and understanding the system. Because not all guidelines are the same. We always think that, the United States is the center of the universe, but it's not. And so, the United States follows their own guidelines, obviously, and Canada kind of follows suit. But Australia and New Zealand have their own, but also follow very closely the UK.
Mm.
So just kind of learning those those differences, maybe differences in antibiotics, slight differences in how you treat things. They're not going to be polar opposites, but
Right.
slight differences. So I felt it was more of a collegial relationship, not something where you have a supervisor standing over your shoulder,
Mm.
barking orders to you or making you demoted to a registrar level. That is
Right.
not what's happening.
And just to clarify, registrar is kind of like a resident or
Residents,
intern.
yes.
Okay, okay.
You see, my brain has switched over into the
You have lived in Australia and New Zealand for a bit.
yes.
And how did you approach finding a job, I guess, initially in New Zealand and then in Australia later?
So when I first came to New Zealand, we came on a locum. So we
Right.
came with a locums company when we first arrived in New Zealand in 2010. But when I came back to New Zealand after our 1 year locum, because I was a little bit more familiar with the system, I had met so many people, I knew about working in the system, and I learned more about the setup of the health system there. I felt very comfortable with finding my own job. And so I knew how to find those jobs, where the websites that were used to publish, the clearinghouse of the jobs that were available. So I was able to utilize
Mm.
that knowledge without having to, go through a third party.
Okay. And then in moving to Australia, did you kind of find the job on your own through colleagues that you had established?
I did. I
Okay.
actually found my job. I think I did a Google search.
Okay.
Google does everything, but
Yeah.
yeah, I was literally able to find it just very simply through a web search. And once
Got
again,
it.
I think that knowing that inside knowledge, knowing
Mm.
kind of how the health systems are set up and how to find those jobs definitely helped.
Yeah. And do you need to be a fellow of the Royal Australasian College of Physicians prior to finding a job and prior to working, or where does that come in?
So, good question. So, the system is a little, it's very complicated and complex in a way, but it kind of gets clearer, I think, once you
Mm.
kind of read through it several times.
Yeah.
So the very first step is for any attending doctor that wants to come over. The very first thing is you do have to get your credentials verified by your
Yeah.
college. So I'm RANZCOG, Royal Australian New
Mm.
Zealand College of Obstetrics and Gynecologists. So you would get your credentials certified by your individual college, and they're the ones that will basically look over your
Mm.
diplomas, your board certification, and say, okay, well, this person is equivalent to an Australasian fellow of our college. They'll
Okay.
probably be fine. And then they decide on your supervision. So
Got
for
it.
very senior doctors, it might be as short as 6 months. So I've seen
Okay.
people who've been out of residency for like 15, 20
Mm.
years. They only have to do like a little 6 months because they're very, very senior.
Yeah.
But then most of us usually get 1 year supervision. And that's what I've seen in general for most doctors from the United States.
Okay.
And then after that 1 year of supervision, you basically just, sign a couple of papers saying that you finished your 1 year and now you're a fellow of your
Wow.
Australia, New Zealand college.
Okay, that sounds awesome. And for those interested in more academic positions, how should they kind of go about the job search?
So it's very different
Mm.
than what we normally see in the United States, in that truly academic positions are not held specifically in one particular area. So for
Mm.
example, I trained in Houston. So there's not going to be a lot of Baylor colleges of medicine and those
Mm.
types of things. So for a lot of us, academics can literally be at any public hospital
Got
that
it.
you work at, because they'll sometimes have a training program
Mm.
associated with them. But that's most public hospitals. So it's a little
Mm.
bit different in that I find that academic means literally almost any hospital
Okay.
that has residents that are there. So
Got
you
it.
actually could get working with a resident where you're always teaching and always doing academic things like audits, like research projects, those
Mm.
types of things. Now, of course, you could be at the major tertiary centers where
Mm.
there's going to be like research being churned out all the time
Got it.
and a lot of bench research, those types of things. But I feel that it's a little bit different than what
Mm.
we associate it with in the United States.
Got it. Okay. And how is the immigration process?
Ooh, that's another one.
Yeah.
Really tricky. So,
Yes.
as you know, COVID has changed a lot
Yeah,
for
of
us.
course.
Prior to COVID, it was pretty straightforward. So
Mm.
there's different visa streams depending on how long you want to stay. And almost both countries had significant shortages in
Mm.
physician jobs. And so we were all pretty much under like a skilled migrant pathway.
Okay.
And they had different length visas depending on like how long you wanted to wait basically until you got in. You can actually apply before you leave US soil, at least you
Mm.
could before COVID. Which is actually what we did. So my husband and I applied for permanent residency for New Zealand before we even left.
Wow. Okay.
And those processes can actually take a very long time. For Australia right now, the skilled migrant pathway for residencies, I believe it takes about 12 months to get that visa done. So,
Okay.
and that's before you hit soil. So that's a long time. But the
Yeah.
good side of it is that if you're not quite ready to make that leap, you
Yeah.
could start the process. It is definitely a financial commitment because you're going to
Mm.
be paying lots of money
Of
for
course.
fees, but you could start the process before you leave US soil. But there are different category visas
Right.
depending on how long you want to stay, but most of us fall under some type of skilled migrant pathway.
Okay. So it sounds like looking for the skilled migrant pathway would probably be the best way to go for most people.
Exactly, exactly.
Okay.
Unless, of course, you want to do something shorter term, you can actually get a locum visa.
Okay.
Um, those are very short. It usually takes, maybe 6 to 8 weeks prior to COVID to
Oh,
get those done.
okay.
But they are short term. They
Mm-hmm.
are tied to your job. So
Mm.
the locum visa is only as good as your locum contract. Once
Got
your
it.
contract is finished, it's time to go.
Time to
So
go.
that's really for people who are really like, okay, I'm only going to be here for 1 year, 18
Right.
months or whatever.
Okay. And what were some of the workplace or cultural differences that you noticed between America and then New Zealand and or Australia?
Um, I think one of the best things is that it is the difference in the practice of medicine.
Mm.
There is no middle layer of billing, coding, insurance, and those types of things because they're
Mm.
both universal healthcare systems. And
Right.
so for me, being able to let go of that middle layer, not having to worry about
Wow.
billing and coding, being able to see a patient, order whatever test I want on them, or do whatever type of investigation because I can, and I think that's the right thing to do rather than have to check. I
Right.
think the biggest thing that we have to realize is that it is completely different in that, for example, medications. New Zealand has something called Pharmac, which is where the government negotiates with drug companies for the best prices on medications. But that also means that you don't have the breadth of medications that you do in the
Mm.
United States. So I told one of my friends as a joke when I moved to New Zealand in 2010. I remember telling her, well, patients have an option of a Mirena or a Mirena. We didn't have any other options. And so you don't have like 7 different,
Yeah.
um, antiemetics to choose from. It's very limited
Yeah.
on what options you have, which also make it easy because it's like
Mm.
it's in here really quickly because it's only
Yeah.
like 5 of these drugs you can choose or 2 of these drugs.
Yeah.
Um, but I find that having to learn those cultural differences,
Mm.
that was a little difficult. Like I said, the instruments in theater,
Yeah.
or those words, theater,
Yeah,
the
the
operating
word.
room, registrars, residents,
Mhm.
consultant, attending,
Mhm.
those those different nuances, a different, knowing it's more of an English kind of type of background as far as the medical system versus what we're used to as American words that we're used to. So there are some differences. And I think that's why the supervision time is, because it just gives you that person that you can go to and say, hey, what are they saying when they're doing this? Or is this routine? Or can you give me some ideas and the guidelines and where those came from? So it's, I think, a very helpful time as far as transition.
Oh, super interesting. And then I'm assuming they have an electronic medical record. No, they don't have it. Can you tell us about documentation?
Absolutely amazing. So they're a little bit further behind as far as the use of technology in like the day-to-day medical life. Now, granted, we do have labs that you can pull up on the computer. Yes.
Right.
But as far as actually using an EMR, when I left New Zealand, even when I went back, we didn't have an EMR at all, period. Which is refreshing. So what I actually did is I had a pen, paper, and I would actually write in a chart my notes. And then I would dictate my notes to the patient's referring doctor, who's their GP or their family practice doctor. So it's very old school. And what was really amazing about it is where I was in New Zealand, a lot of patients had been born at the same hospital that I worked at. So their charts would be in volumes, and some of their notes from the 1970s and 60s and sometimes earlier would actually still be in their charts. And it would be on a typewriter.
Oh my God.
An actual typewriter. So it's just amazing. It's almost like what it would have been like to practice in the like 1960s and 70s before the encroachment of all the electronic types of things. But there are things that do make your life easier. You have, access to the radiology reports, so you can easily look at films and everything. But as far as the actual EMR, where you're going into a room with the tablet things, that has not been adopted widely. Definitely not in New Zealand, a little bit in Australia, especially in the major cities, but not so much in the rural or even some of the suburban areas.
Oh, wow.
My hospital does not have an EMR.
Wow.
And I'm outside of Melbourne.
Wow. And how do the physician salaries compare to those in the US, in New Zealand or Australia?
So that's also another really interesting, I think, falsehood. I think that sometimes we think that in the United States is like where you make the most money as a physician. And I think as physicians, we have to look at it more in a kind of a different perspective. So first and foremost, Australia and New Zealand are very different with their salary structures.
Okay.
One of my friends did say, you don't go to New Zealand to make a lot of money. You go there for the lifestyle. New Zealand is very slow. There's not a lot of people. It's only 4 million people. My clinics were so incredibly just lax and relaxed compared to what I was used to as an obstetrician. So, for example, in my antenatal clinics in the United States, I would see sometimes 20, 25 people in a half-day session.
Wow. A half-day session? Wow. Okay.
Our visits were scheduled for 5 to 10 minutes, which is ridiculous. You'd always be behind. And so needless to say, you see why I left. So it was very normal to see 40, 50 patients in a day. Whereas in New Zealand, in my clinics, I would see maybe 5 or 8, maybe. And then get a lot of apologies from the nursing staff and everything about how many patients they had to put in with me. So it's a very different perspective as far as how hard you have to work. There's really an emphasis towards quality of work. But in New Zealand, the salary is a lot lower than what you see in the United States. Their salary scale is very transparent, and it is set up through the collective bargaining agreement with the physician union. So anybody who wants to see how much you make in New Zealand can easily get online and see. It is based on how many years out of board certification that you are.
Got it.
So if you are an older doctor, you obviously make a lot more money than someone who is fresh out of residency. Interesting enough, it's the same way for residency. So as you can imagine, if you're finishing your residency, you're at the top of the salary scale. But then when you graduate and become an attending, you go to the bottom. So you actually will sometimes make more money as a senior resident than as a first year attending.
What?
it's a very interesting kind of
Yeah.
system. But yeah, so the salary in New Zealand is a lot lower than what we expect in the United States. And once again, I think the quality of life
Mhm.
and why you're coming to New Zealand plays
Yeah.
into it. Now, Australia is a very different animal, and the salaries in Australia are very high, like very
Mm.
high, which
Wow.
is interesting because unfortunately, that's part of the reason of the brain drain and the reason why New Zealand has so many
Oh.
American doctors and
Mhm.
English and UK trained doctors coming over, because there seems to be this nice little circular thing where doctors leave New Zealand to go to Australia or the UK, and the UK doctors come to
Mm.
New Zealand. And so there's this nice little ebb and flow that works. But Australia makes their salaries are up to 40 to sometimes 50% higher than New Zealand.
Wow.
So that's a huge difference.
Yeah.
Um, yeah, and so there's like a huge difference as far as in the salaries, and there's a significant ability to make more if you do private practice in Australia,
Mhm.
which is a really big area, especially somewhere around the cities that you can make a significant amount more.
Wow.
I also, just to mention to the unions, that's another thing
Yeah.
that I think doctors don't take into consideration, that when you're looking at salary, that's one part, but
Right.
consider things like the package, the benefits.
Mhm.
So look at the vacation that you get, the CME benefits, the CME leave, the sick leave, those types of things. So if you look at the whole package, it actually could be very similar to what you're making in the United States if you do look at it as a whole.
Yeah. I mean, I think it's incredible that they even have physician unions, which feels like such a foreign concept in the US.
Yeah, I love the union. I love the union. It's the greatest thing ever.
And what have you enjoyed the most about your move to Australia or New
Um,
Zealand and then Australia?
I would think that it's obvious. It's really honestly finding the joy in practicing medicine again.
Mm.
I was so burnt out that I was actually trying to find ways out of clinical medicine. And that was young. I was kind of young in my career. I think I was only, when we moved to New Zealand, I was only 6 years out of
Wow.
residency at that time and nowhere near retirement. And
Mhm.
just the idea of trying to make it through another, 20 years at that pace to me just seemed impossible. And so I was really looking at, my career like, okay, this is it. I did, 5, 6, 7 years. I tried different things, different places. Nothing worked. I wasn't happy. And I was honestly just crispy fried burnt. And so moving to New Zealand, it literally felt like I had stopped time, taken a really deep breath, and like wholly rejuvenated my career and my joy in medicine and why I got into it in the first place.
Mm.
And having that connection with patients, I'd been missing that I never got a connection with patients like that before. It was just such a beautiful breath of fresh air and a start over. And it's the same in Australia, just having that ability to control that narrative with the patient and not
Mm.
having those layers in between. It's a really refreshing feeling.
Yeah, I mean, I think the feeling of being burnt out, I mean, study after study shows that physicians have such high rates of burnout. And to have a change where that physician patient relationship is re emphasized and is important again, I think adds a lot of value. So I can totally understand and imagine what that difference must have felt like. Um,
Definitely.
Anything you wish, what were kind of the challenges as you made this transition and anything that you wish that you had known in advance?
Um, I think that we were really lucky in that we had people in our lives that kind of gave us a lot of like inside track information that helped us with
Mhm.
our move over. And these were non-physicians. We actually met an American who was living, well, she was married to a New Zealand citizen. They were moving back, and that gave us kind of a lot of tips as far as moving to New Zealand. And in hindsight, I wish I had have paid a little bit more attention to some of the things they were saying as far as the advice, because I think at the time we were so just kind of excited and giddy, but we weren't really thinking about the future. And so what they were telling us was really some really important information as far as, making the permanent move, the kind of things that they would recommend bringing with us, not bringing with us, um, where in the country to look at those types of things. Because I think that could have changed things a bit for us. I think that sometimes we're just so desperate to just say, oh, I just want to start something new, that you don't look at it completely. And so our first job, we were like, oh, I don't really like this particular area. We should move somewhere else. But had we really listened, we might have just waited a little bit and tried to find a job somewhere else. But it all worked out in the end. But I just really think that advice I would say is that, look at the entire picture, thinking about exactly what your end goals are, and maybe set some, short-term goals and long-term goals. And also definitely talk to someone that is actually on the ground, because that I think helps as far as preventing disappointment, because there are going to be some differences in practice and not everybody is going to be happy. I know a couple of doctors who have left New Zealand because they weren't happy and they had specific reasons about practice and how things were. They felt that things were too slow. And so for some doctors who are just really like control type A, they might not be happy with that. So I think there's a lot to be said about doing that research ahead of time.
Yeah. And like you said, it can be really daunting to move across the world. And it seems like you have created a consultancy to help people achieve just that, to help them transition, but try to avoid some of the challenges that you may have experienced. So tell us about ExpatMD.
So I actually started ExpatMD late last year, and this is after 8 years of helping other doctors move overseas. And so I was introduced to different people by word of mouth through Facebook groups and friends that were like, oh, I have a friend in Carmen, she's in New Zealand, talk to her. And so little by little, I would be up in the middle of the night because of the time difference, texting people and sending them emails about, what they should do and how to get started, helping them with their interviews, helping them with their CV and cover letters. And so after doing it for years, my husband was like, could you please maybe just have a cohesive kind of thing that you do, that instead of doing these little piecemeal type of things, you can actually be helping people for real. And so that's kind of how ExpatMD, actually the book came first, and then the consulting company came following after. But I think the biggest key is that I want to empower physicians to let them know that they can do this process on their own. But if they do need a little bit of help, especially someone, once again, that knows how it feels to be an American physician and how our specialties are in the United States and how they translate into practice styles in New Zealand and Australia, that will help significantly, because there are people who have been very unhappy because of not knowing that the specialty was so different in Australia and New Zealand. Case in point is pediatrics. That is so incredibly different from the United States to Australia and New Zealand. It's like polar opposites in that our pediatricians are usually more outpatient. And so we associate the pediatrician with someone that you go see when your child is sick. And that's not at all how it really is in Australia and New Zealand. Pediatricians are seen as specialists. Family practice GPs are the first point of contact for all children. So you don't see a pediatrician at all unless your child has some kind of problem or illness that a GP or family practice can't manage. And then they're mostly inpatient, not outpatient. And so it's very different. And so a pediatrician coming from the United States might not be able to find a job that suits them because they'll say, I haven't done inpatient peds since residency. So if you can imagine, that may be a barrier for them getting a job because there's not really that niche for outpatient pediatrics. It's usually a part of the specialty that you do outpatient clinics, but they're usually more high risk. So it's a very different kind of system in that way. And so if you don't know that, we have doctors that get placed by locums companies who are really great in, liaising with hospitals, but they would not be able to explain to an American pediatrician how that's very different and how their practice is going to be different. And so I think for us at ExpatMD, what I'm trying to do is I'm trying to bridge that gap.
Mhm.
help physicians get basically settled. But
Yeah.
more importantly is that we're really more for physicians who want a more permanent career in Australia or New
Mhm.
Zealand. Because if they want a locum, that's wonderful and fine. But for doctors who want to make a more long-term
Yeah.
move, we're here to help with their specialty board applications. You're going to
Mhm.
have to go through a whole application process. We're here for interview preparation because there is a really critical interview that you have to do to basically go up in front of your board, your college specialty board, and explain your training, your
Mm.
experience, and also go through what your experience are in the history of your practice and why that would
Mm.
translate really well to Australia or New Zealand. And so after these last 10 years of being overseas and seeing all the specialties and having different doctors and partners in different specialties, we can help with that too. And also, of course, having someone on the ground.
Yeah.
I moved to New Zealand, to our town, sight unseen. I got off the plane by myself with a bunch of suitcases and a couple of boxes to a town I'd never been to.
Yeah.
Driving on the side of a road I've never been on the side of a car. I've never.
Got it.
I wrecked our car the first week. The first
Oh
week I
my
had a car,
gosh.
I wrecked it.
Oh my
So
God. Oh my
I couldn't figure
God.
out this. It was weird. I just
The
I couldn't.
turns are challenging. Yeah.
So it would have been so nice to just kind of
Mm.
have somebody that could have really helped me, like, do all the things that you need to set up your new life. Like, you have to get your tax ID number, you
Mm.
get your bank account set up, trying to find healthcare, book in with a GP
Mm.
because you're expected to have a GP, and childcare and all those
Right.
things is so hard when you're
Yeah.
like not there,
Yeah.
so.
Yeah. Oh, that's wonderful. And it sounds like one of the struggles that a lot of people do have a challenge with is that some of the specialties don't translate the same as they are in the US. They aren't exactly the same in Australia or New Zealand. So knowing that in advance is really important.
It
Um,
is very important.
and in the people that you've worked with, what are the common anxieties that come up as you help them through this transition? And kind of how do you help them with those?
I think the biggest anxiety is the unknown. So once
Mm.
again, most physicians hear about Australia and New Zealand as being
Mm.
a place that they can practice, but they don't really know about the system, the healthcare system, or how it
Mm.
works. And so I think, having someone that can translate, once again,
Yeah.
how specialties work from one country to another. And also, I think a lot of people are anxious about whether or not they'll be successful in their
Mm.
jobs. And I found that most people, when they get here and start working, they're so incredibly excited that they've found a place that they feel comfortable,
Mhm.
that they have a really good collegial group of physicians that they found like nice little cliques to.
Mhm.
It's really nice seeing them kind of flourish and be excited about practice again. So I think most people are anxious about not fitting in and not
Yeah.
understanding how to work in a brand new
Mm.
system. But in general, the human body is same no matter where you go in the world. And physicians are brilliant people. We're very smart people. We can learn, we can adapt.
Right.
So I think it's just understanding there are going to be some differences, but having that
Mm.
ability to adapt is going to be
Mm.
critical.
So having flexibility is going to be very
That's right.
important. Okay.
Very important.
Very important. So one final question. You moved across the world to New Zealand and then Australia. Was it all worth
Absolutely.
it?
I actually laugh and say that now I'm a spoiled Australasian doctor. I don't think I could come back, only because
Mm.
I can't give up my 10 a.m. tea breaks. We
Oh,
have tea
well
breaks.
then.
We have tea breaks. That's what we do. Um, so there's I laugh about, but I like literally just the benefits of practicing and
Mm.
knowing that I have so many different ways to preserve myself, to have
Mm.
that work-life balance and not have people um, feel that I'm, being lazy or not working up
Mm.
to expectations. It's just a really
Wow.
refreshing way of working. And I definitely see myself Now it's not 20 more years in medicine.
Yeah.
Woohoo. Now I'm looking at 12 more years now. Like, I made it. So I've gone down from 20 to 12 more years before I'm thinking about retiring. And it's just been really nice to know that I'm supported in those decisions. And I'm even part-time now, which is something I never thought at this point in my career I would be able to do or afford to do. But once again, I can. And so I definitely say for me, it was beyond worth it. And I think that if you spoke to a lot of the other doctors that are from the United States and settled here in Australia or New Zealand, you'd probably hear some of the same story.
Well, I mean, I just love the fact that you are taking what you have learned over the past 10 years and helping others who want something similar and helping them make that transition just a lot better and a lot smoother and a lot easier.
I think they'll probably be happier than what we were. They probably won't wreck their car the first week either.
I would hope not. I hope not. Well, Dr. Brown, thank you so much for joining us. For those of you interested in moving to Australia and New Zealand, check out her book, ExpatMD, available on Amazon. And also, if you're interested in moving to Australia or New Zealand, check out Dr. Brown's consultancy at ExpatMD.com. We have partnered with Dr. Brown to offer a 10% discount for the Hippocratic Adventures community. Just mention Hippocratic Adventures in her intake form.
Thank you very much.
Wonderful to have you. Just so refreshing to kind of hear the perspective from someone who's been there and has lived there for 10 years. And then to our audience, until next time, remember, together we can dream beyond borders.